Wet the Inion BioRestore Plus block with the patient's blood or marrow, sterile saline, or water. Cut the block to the desired size using surgical instruments such as an oscillating saw, surgical knife, scalpel, or scissors. Further shape the block using surgical cutters to achieve the desired three-dimensional shape. Finalize the shaping of the block using a surgical knife or other suitable surgical instrument. The Inion BioRestore Plus block is now shaped to fit the defect and ready for implantation.